Assalamualaikum warahmatullahi wabarakatuh. Thank you for all participants to join our presentation. Today I will present my literature review with the title The Effectiveness Non-Surgical Therapeutic Approach for Peri-Implantitis. Okay, next let me introduce my team. Me, Aisyah Bella Azzanjani, host speaking in this presenting. From Periodontology Specialist Educational Program of Dentistry Faculty Hasanuddin University and our beloved lecturer, Professor Dr. Mardiana Adam Master Science from Periodontology Department of Dentistry Faculty, Hasanuddin University. Introduction. Peri-implantitis is an inflammatory process that affects soft tissue during osseointegration process. The basis for non-surgical therapy in peri-implantitis is infection control through debridement of implant surface to remove adhering biofilm and reduce bacterial load. Clinical goals of non-surgical approach are to reduce the total number of microorganisms on the titanium surface, to reduce probing pocket depth, to reduce and eliminate bleeding on probing, to improve measure of maintain self-administered oral and dental hygiene and peri-implant tissue health, to prevent reinfection. Non-surgical treatment for peri-implantitis: 1. Mechanical instrumentation. 2. Ultrasonic debridement. 3. Laser. 4. Antibiotic therapy. Mechanical instrumentation: there are aimed more subgenically to decontaminate the exposed implant surface. Different types of curette has been studied, mainly those made of carbon fiber or titanium, and most of the protocol include an adjunctive polish with a rubber cap and polishing paste. Standard powered abrasive systems are based on the air spray of sodium bicarbonate. Recently, a powered air-abrasive system based on low-abrasive amino acid glycine powder. It used a specially designed nozzle consisting of a thin, flexible plastic tube length 1.7 cm and diameter 0.8 mm at the tip. That is 50 with three orthogonally oriented holes. This specific design is associated with the horizontal axis of the air mixture and reduced pressure, thus preventing the formation of emphysema in this adjacent tissue. The handpiece airflow EL3088 electromedical system neon Sweden should be guide a circulation motion from coronal to apical parallel to the implant surface in non-contact mode, and the instrumentation time at each aspect, nasal, distal, vestibular, and oral, should be limited to 5 cs and recommended by manufacturer. It has also been recommended to place the nozzle in this pocket mesially, lingually, distally, and buccally for 15 15-inch position. The nozzle should be moved with a circumferential movement around the implant, attempting to cover the entire exposed implant surface. Ultrasonic debridement. The aim of ultrasonic device is to remove biofilm and calculus during the treatment for peri-implantitis without altering the implant surface. Whereas to accomplish this, different tip modifications have been proposed, such as a carbon fiber, silicone, or plastic. Another modification to the conventional ultrasonic device is the vector system. Dental by the Bayesian Germany, in which the horizontal vibration is converted by a resonance ring into vertical vibration, resulting in parallel movement of the working tip to the surface. Laser. The use of diode laser is on the best new technique for non-surgical periodontal treatment and has advantage of being able to reach areas that cannot be approached by conventional mechanical instrumentation. Laser have potential advantages such as antibacterial effect and stimulation of wound healing. The erbium doped yttrium aluminum granate laser is a type of laser that has shown promising results for food future implementation in the treatment for peri-implantitis due to its ability efficiently remove subgingival plaque and calculus without damaging the implant surface. Study by Mayonnaise which analyzed the use of diode laser on soft tissue lesion in vitro and in vivo reported a stimulation tissue repair that was in the form of increased granulation tissue, accelerated epitheliation process, increased fibroblast proliferation, increased matrix synthesis, and increased new vascularization formation. The diode laser has adequate hemostasis, proper incision margin, accelerate the inflammatory pace, has cold reduce inflammation. All these things speed up healing process. Antibiotic therapy as additional therapy. Additional therapies such as antiseptic and antibiotic have been proposed to improve the outcome of non-surgical debridement due to the air capacity is reducing bacterial loads to a probe level that is difficult aside using mechanical meshing alone. Thus, the chlorhexidine-based products in the form of gel irrigant of mouthwash have been widely used as adjunct therapy. Additional procedures are given, namely administration of locally and systemically administered antibiotics among the locally administered adjunctional antimicrobials. Those that are most effective are tetracycline, doxycycline, metronidazole, minocycline, and chlorhexidine. Systematic antibiotic therapy provides more benefit than that administered locally. Systemic antibiotic can be administered by serum to the bottom of the pocket and affect tissue invasive organisms. Discussion. Removal of the biofilm and mineral deposit from tooth surface is a basic aspect of treatment. Mechanical debridement around dental implant and various non-surgical therapeutic approaches are vital components. Decision regarding whether the problematic implant should be treated its surrounding tissue should be maintained in healthy condition using non-surgical or surgical therapy is also related to patient behavior. Non-surgical treatment combined with good oral hygiene will help in controlling the infection without further surgical intervention. And implant infection probing depth of 5 and 6 millimeter are common or treated with non-surgical therapy. In non-surgical approach, laser therapy is not only advantageous due to these bactericidal properties but can also reduce bacteremia with less post-treatment inflammation and edema. Conclusion: there is a significant effectiveness of non-surgical therapy in peri-implantitis treatment. Non-surgical therapy showed clinical signs of healing, such as decreased bleeding tendency and reduced pocket depth. If complete resolution of peri-implantitis is seen with non-surgical therapy, the patient should be admitted to the supportive care phase. Surgical treatment should be considered if peri-implantitis persists after non-surgical therapy. This is my reference. Thank you. Assalamualaikum warahmatullahi wabarakatuh.